HPV is short for human papillomavirus. It is a virus that likes living in the epithelial cells. Some high-risk HPVs are linked to developing cervical cancer if they go for a long time untreated. There are high and low risk HPVs. High risk HPVs qualifies high risk for certain types of cancers. In our case, the cervical cancer screening is what is interesting. The low risk types can also cause genital warts, for example, and there are a bunch of other types of HPV that are not even necessarily typed because they have no clinical relevance in regard to gynecological health or any other kind of health. There are different kinds of HPV screening opportunities. Generally in Hungary, what we do is we have the opportunity to take the HPV screening when we do the pap smear, which uses a small kind of brush or a swab to obtain a sample, which then we send off to the laboratory where they do their testing on the samples that we send them. There are kits that you can purchase where you can obtain the sample yourself, but generally it's a safer bet if you have the clinician who obtains the sample because it's definitely taken from the correct place. Pap smears and cervical cancer screening is recommended from age 21, regardless of whether or not they have initiated sexual intercourse or are involved with anybody. For patients who are sexually active and are over 21 years old, in Hungary, the general procedure is that we take the pap smear every year. Having a negative HPV screening as well, done at the same time, is called co-testing. It does mean a significant protective factor. So in this case, obviously discuss it with your doctor of choice. But in this case, it is possible to do cancer screening less frequently every 3 years. If your pap smear was negative, but you have tested positive for HPV, then it is generally recommended to have the HPV screening done again in a year. And if you have 2 consecutive years where you have a high-risk HPV, then it is generally recommended to do a colposcopy, where they take a microscope, basically, and take a close look at the epithelium, the cells lining your cervix. Depending on if they find anything, then there is an opportunity during the colposcopy, generally, to take biopsy if it is necessary. The HPV vaccine is currently, luckily, administered to children in school. It's recommended from around year 11 to 12, generally before they have initiated sexual intercourse. If you test positive for HPV, it is still generally recommended to get the vaccination because there are several types of HPV that are linked to posing a high risk for cervical cancer later on in the years. If you are sexually active but haven't been vaccinated, and if you're under 45 years, then it is recommended to get the vaccination. It is especially recommended for people who have multiple partners, or if they work in healthcare, it is also more recommended. If you're vaccinated for HPV, it doesn't mean that you won't contract any kind of HPV. It basically gives your immune system a boost to be able to manage the HPV infection better. Pre-existing positive HPV tests will not be affected by having a vaccination.